Today we will be showing you the basics on how to take blood pressure. Some things to consider before testing. Make sure your patient has not ingested any caffeine or nicotine 30 minutes prior. You will also want to make sure your patient has been seated at least 5 minutes before testing. When setting up your patient, you want to make sure that their feet are flat on the ground, their back is supported, and their palms are facing upward, and their arms are near heart level. We will be using two pieces of equipment to measure blood pressure, one of which is the stethoscope and the other is the sphygmomanometer. When using the stethoscope, you want to make sure that the earbuds are pointed out away from you, not towards you. Otherwise, you will not be able to hear. You will know they are set up correctly when you put the earbuds on, tap the diaphragm, you'll hear a loud thumping sound in your ear. The second piece of equipment is the sphygmomanometer. Before pumping the air, you want to make sure that the valve is turned all the way right, making sure it's closed. To release, simply turn to the left. The pump will indicate how many millimeters of mercury you have pumped up into the cuff. Before taking blood pressure, it is important to palpate the brachial artery on the patient's arm. This will allow you to find a pulse, and that is where you will put your stethoscope. The size of the cuff you use will be dependent on how big your patient's arm is. If the cuff is too small or too large, it can give a very inaccurate measurement. Once the cuff is on, you should be able to stick 2 fingers inside of the cuff. If you cannot, this means that the cuff is too tight and needs to be loosened a bit. On the cuff, there will be a mark pointing to where the brachial artery should be. You want to take the stethoscope and put it on the brachial artery to listen for the heartbeat. You will want to pump up the cuff to about 200 millimeters of mercury, no more than that. Once it is pumped to 200 millimeters of mercury, you will begin releasing it by turning the valve to the left. You will release at about 2 to 5 millimeters of mercury per second. You will now listen for what are called Korsakoff sounds. The first sound that you hear will be known as the systolic blood pressure, while the last sound you hear, before the sound completely disappears, will be known as the diastolic blood pressure. If you are going to do more than one test, you must give your patient at least 1 minute in between trials. Using this chart, you may classify your patient as either normal, prehypertensive, or hypertensive according to the numbers you obtained.